You know, sometimes the most incredible stories are buried in the most unlikely places, like a dry government report. And today, we're digging into one of those, a surprising health story out of Japan that starts with this massive success story, but then reveals a really critical challenge for the country's future.
So let's start with a number. 51.6%. Just look at it. What do you think that could be? An election result? A passing grade on a test? It seems so random, but this single number tells a huge story about the health of an entire nation.
So, what is it? Is this number a sign that something's wrong, that we've only just scraped by, or is it a symbol of a massive, hard-won victory?
It's a major national achievement. For decades, Japan has had this public health goal called 80-20. The idea is simple. Help people keep at least 20 of their own teeth by the time they hit 80 years old. And as of 2022, they did it. Over half of all 80-year-olds have met that goal. I mean, that's a huge win for public health, but that's not the whole story.
Because that success actually hides this really interesting paradox in Japan's dental health. It's like a tale of two different trends. While they've made incredible progress in one area, another, much more stubborn problem is still hanging around. So, the good news is fantastic, right? Cavities in kids have been dropping and dropping for decades. Amazing. But then you look at the other side of the coin. Almost half of all adults, we're talking 47.9%, have moderate to severe gum disease. And unlike with cavities, that number just isn't getting any better. And this is where our story really takes a turn.
See, to fight a problem like adult gum disease, you need a very specialized workforce. You need people on the front lines. But Japan is facing a critical shortage of the exact professionals needed for this fight: dental hygienists.
Okay, so as of 2022, this is the total number of people in Japan with a license to be a dental hygienist. Over 300,000 qualified professionals. That sounds like a pretty big number, doesn't it?
But now, look at this number. This is how many of them are actually working in the field. The huge, huge gap between those two numbers, well, that's the core of Japan's hidden crisis. Just think about that for a second. Less than half of all licensed dental hygienists are actually on the job. That means more than half, 53.8%, are not working, even though they have the qualifications. So what in the world is going on?
To figure this out, you have to think of the career path for a hygienist as a leaky pipeline. You have all these skilled professionals entering the field, but then somewhere along the way, they're just leaking out of the workforce.
And if you look at the age of the hygienists who are working, a really clear pattern just jumps out. You see a lot of them working in their late 20s, but then a big dip in their early 30s. It starts to recover later in their 40s, but what is happening right at that 30 to 34-year-old mark?
And here it is. Here's the crucial piece of the puzzle. The profession is over 99% female. That career dip we just saw, it lines up almost perfectly with the average age for childbirth and raising a young family in Japan. For way too many, it becomes this impossible choice between their career and their family.
And look, this isn't just speculation. The government itself says it out loud. This quote is right from the Ministry of Health, Labor, and Welfare report. They state flat out that it's important to create a system that lets people work while also handling childcare or even elder care. They know it's a problem. So why does a leaky pipeline in this one profession matter so much to the whole country? Because this workforce shortage is on a direct collision course with Japan's single biggest demographic challenge, its rapidly aging population.
Let's just connect the dots. It creates this really dangerous chain reaction. 1, Japan's population is aging fast. 2, that means way more elderly people need care at home or in nursing homes. 3, we have rock-solid proof that good oral care, the kind hygienists provide, can prevent deadly pneumonia and get people out of the hospital faster. And 4, there's a shortage of hygienists to actually provide this critical, life-saving care.
And the disconnect is just staggering. The need for at-home oral care is exploding, but a shockingly small number of dental clinics, just 6.9%, actually send hygienists out for home visits. It's created this massive, dangerous gap in care for the people who need it most.
Okay, so the situation is definitely serious. But, and this is the good news, it's not being ignored. The government sees the problem and they're actually putting a plan together to fix this leaky pipeline and make sure the future of care is secure.
And this isn't just talk, there's an actual timeline. Starting this year, a government committee is re-examining everything a hygienist does. Next year, they're going to do a deep dive on supply and demand. And by 2026, the plan is to have real concrete solutions ready to go for recruitment, for retention, and for education.
And they are looking at everything. I mean, everything. They're talking about expanding what hygienists can even legally do, like giving local anesthesia. They're trying to figure out how to support hygienists who left the field so they can come back. They're looking at creating real career paths, improving teamwork with doctors and nurses, and trying to fix the problem where some parts of the country have way fewer hygienists than others.
So, it all comes down to this one critical question. The success of that 80-20 campaign proved what Japan's healthcare system can accomplish when it sets its mind to something. But this crisis of the vanishing hygienist, it's a totally new kind of test. It's not just about caring for patients anymore. It's about building a system that also cares for its caregivers. And honestly, the health of the entire nation might just depend on the answer.